Pulmonologists deal with diseases of the respiratory tract, things like asthma, emphysema, and even now coronavirus. So with that being said, coronavirus patients are looking to see how this disease impacts the ability for their lungs to function. Dr. Tanesh Janayaka is a pulmonologist at Backus Hospital. He joins us now this morning to talk a little bit more about this. Doctor, thank you so much for taking some time to chat with us here today. We're looking to see what things are like for you of treating COVID patients.
Sure. So as critical care doctors, it's me and one of my colleagues who see these patients, and basically, we're dealing with the sickest patients in the hospital, really, and about 5% of patients with COVID will need critical care. And so we're dealing with patients on the ventilators you hear about in the news, patients on multiple medications, and what really challenges us is that the patients' families can't see them. And so we have to deal with that as well.
So are you looking at any new treatments that you or your team might be using at Backus to help these COVID patients?
So we are. Every day, something is changing in terms of research. We're in the infancy of this pandemic, so a lot of what we do is based on basically what our other countries, other states have seen before us. So some of the things that we are trying are the convalescent plasma, which again, there's no hard research on this, but it makes theoretical sense to give patients antibodies from patients who have recovered from the disease to patients with active disease.
Okay, so what are your thoughts about the future of COVID-19, this virus, or how treatments might change as we start to learn more?
So I'm a big believer in human ingenuity and innovation. So I really do think we're going to overcome this. The time frame of that is a big question mark, but I think a vaccination is key. Hopefully, the CDC hopes for 1 to 2 years in terms of coming out with one. I think in terms of what we have to do as a population, in terms of social distancing, wearing a mask, really meticulous hand hygiene is really important as we open up the state, because we don't want to have a large surge again and overwhelm the hospital. So as we open up the state, my big message is to still practice the social distancing that we've talked about.
Okay, fantastic. Some good advice there. Dr. Tanesh Janayaka, we thank you for that insight and for joining us here today.
Thank you. My pleasure.